my topic is on clinical evidence, but before that I'll be sharing some data also. So as already discussed by Manish sir, the medial pivot design seeks to emulate the knee's natural kinematics by restoring the natural motion and stability. Its implant geometry was intended to achieve stability in the antero-posterior direction and to improve the complication rates seen with the conventional TKRs like the irregular kinematics, the abnormal patellar tracking, the polyethylene wear, and poor range of motion. So the theoretical advantages of the design are restoration of the normal knee kinematics and stability, the optimization of the range of motion, improvement of the clinical wear rates, and preservation of the bone stock. Now, what does the literature say? So, Wright Medical are now acquired by the Microport. They started it in like 1998. Then came Medecta, Finsbury, Met Ortho. All these companies have a literature data of more than 15-20 years, as said by sir. So, coming to the survivorship data, amongst the prospective studies, there was a study reported on the longest follow-up available in the literature with cumulative survivorship of 98% at 17 years. And one more study they have reported the longest follow-up. This was amongst the retrospective observational studies. A success rate of 97% at 15 years with revision for any reason as the endpoint. There are 19 retrospective studies with a total of 3,736 TKRs, all with an average follow-up of more than 6 years. And amongst these, Zhang et al. Have evaluated more than 1,100 patients, the largest case series published in the medial pivot knees, with good to excellent outcomes and a mid-term cumulative survival rate of 99% at around 10 years. There are also some comparative studies. The outcome of the medial pivot implant is compared with the other type of inserts. Batra et al. They reported increased knee society score, the satisfaction and the expectation scores at 4-year of follow-up for the medial pivot design compared to the PS implants. And Shakya et al. Reported no differences in clinical outcome of the medial pivot implant when compared to the rotating platform design. However, in this study, the findings described better forgotten joint score and functional knee society score of the medial pivot implants at a 7-year follow-up. One more study by Chang had no significant differences in the outcomes at 2-year follow-up between the medial pivot and the PS implants in association with single radius design. And this is a recent study, Ettinger et al. They reported that medial pivot knee replacement associated with kinematic alignment had a superior forgotten joint score as well as higher expectation and satisfaction at 2 years of follow-up. So coming to our study, we have a short-term clinical assessment of the XL medial pivot knee prosthesis in total knee arthroplasty. It is a single center study cohort which enrolled 253 patients and evaluated a total of 341 knees. The age group was between 55 to 86 years, 120 females and 133 males. And a total of 253 procedures were performed, which included 88 bilateral knees. The inclusion and the exclusion criteria were the same as for any conventional total knee replacement. And the results were analyzed on the basis of the knee society score, which assesses the stability, alignment, the range of motion, symptoms, patient satisfaction, and the functional capacity, as well as the WOMAC score, which consists of a questionnaire of 24 questions, which evaluates pain, stiffness, and physical function. So, the mean knee society score showed an improvement over time of 20 months, and the WOMAC score also improved. Here, the WOMAC score, if there is a decrease in WOMAC score, it shows improvement. So, the knee society score post-operatively improved significantly from 52.3 to around 80, which suggests the improvement in the pain, the range of motion, as well as the stability. and the WOMAC score, which was pre-operative of around 84, improved to 37, which showed significant improvement in pain, stiffness, and the physical function. So the XL medial pivot knee prosthesis demonstrated excellent clinical outcome in the patients undergoing TKR with significant improvement in the pain relief, functional mobility, and overall quality of life. These results highlight the effectiveness of the XL MPK joint as a reliable and well-tolerated treatment option, supporting its role in enhancing the patient outcomes. To conclude, a continued research with an extended follow-up periods will be essential to fully assess the implant durability and long-term patient satisfaction. The XL medial pivot knee represents an effective and promising solution. However, with appropriate patient selection, a meticulous surgical technique, and a comprehensive post-op care, it has the potential to enhance surgical success rates, improve functional independence, and significantly elevate the quality of life for the individuals undergoing knee replacement. Thank you.